Okay, so let's talk about the global health proposal. So notice the word proposal. So I know you've seen this before. I provided it to you back in early March when I sent out the email. However, it is posted in the course too, so you can bring this up. So the whole purpose of this assignment is for groups of 4 of you. I've gotten most of the groups, but heads up, guys, I don't have, I think, at least 4 people who have not been assigned to a group or told me that they're in the group. And I've also created groups for you within Canvas in our course so that you can work together on items, okay? So somebody send me an email quick so I can build those final groups. Alrighty, moving on. So the assignment is for you to describe a global health or social issue in a selected country or region. And then at the bottom of this page are resources for you to, if you can't think of anything from reviewing the news or our readings or our speakers, there is a link for you to go look at some options there. But you're supposed to propose a plan to improve related health outcomes, and working, of course, in partnership with the people in the country. Think about what our speakers have said, that it is it's best if we work with the people on the ground, and we were given some, especially from Sarah, she gave us some good examples of how when she was in, was it Nigeria? Okay, so start out with a description. You should be focusing on your selected country or region, giving a description of the population. If it is a particular age group or ethnic or racial group, please make sure that you identify that. Describe the epidemiology, and you need to show me that you understand the health determinants, social health determinants, and their impact on the issue. Make sure that you're using evidence-based sources. Provide at least one example of how this issue is addressed through global, national, or local health systems in the selected country or region. Make sure that you bring into the discussion the nursing workforce patterns in the region. You might have to do some digging on this if you're choosing a more regional region that is underserved as far as access to care. That could be difficult. Do your best, and at least note that the resources are very scarce. The other next thing is partnership. Identify, based on evidence-based practice, the issues as outlined. Go to the links in the course for the World Health Organization. You have to make sure, and again, bring in thinking about the concepts that we've covered: social justice, intersectionality, global health competencies. That's a place, go to each of the weeks that we've covered so far, and there's links in there, readings, PowerPoints, videos. Identify the stakeholder groups with whom you should be partnering in that setting. Propose a plan to enact the accepted principles of partnership, and describe how the partnership will be enacted to implement what you have identified as the evidence-based practice solution that's part of your proposal. Okay, so one thing that I heard from the people who taught the course in fall to the traditional students was that they forgot to make sure that you are following, including the nursing process. And one of those things is to educate. That's what we do. So make sure that in describing the partnership and what you plan to do, that you are strongly including how you are going to implement education for the targeted population. So here are some of the resources for you, which should help you select. I would think you need to first identify your population and the setting that you're going to be addressing, and then move through here. There's resources in Stanhope and Lancaster, and there's more here for you as links, but go back to what we've covered in our weeks. So work your way through describing the epidemiology, the health determinants, what is the impact to the health of what you have identified, making sure you address the evidence-based sources that you are using to rely on to develop your proposal. Okay, so more evidence-based resources here. You need to provide one example of how this issue is addressed through the global, national, or local health system, right there in your selected region. Talk about the nursing workforce. Note it, and again, I said this might be a challenge, but they do have some ideas for you here, places where you can go. Who are you partnering with? This is a longer explanation and gives you an idea of who, and keep in mind here, village leaders, thinking about the example like from Nigeria, where they had to seek out the tribal leaders and run everything past them first, get their buy-in, and then they were allowed to address the issues, remember, with the gold mining and the lead exposure for the children. So that going to that depth and investigating is what the explanation or expectation here is. Now, ultimately, what you're going to do with this is on the last 2 days of class, we are going to hear what you have come up with. So what should this look like? Think about how we've displayed topics and made connections and shared information. And that is using PowerPoint, bringing up embedded videos from within there. You can provide handouts to everyone. You can show what you developed if you go into creating the actual education session for the targeted population. Show us what you maybe would hand out, and keeping in mind that you need to tailor it to their abilities and make it interesting for them. There is a rubric. I'm going to have to build this in Canvas myself. I had to do that for your intersectionality paper and then also for your midterm exam. I had been under the impression this was going to be done based on what I had provided to the team, but we're running out of time and I'm just going to have to do this myself for you. So, okay. Here are the other criteria, and I will have this done by the end of the day, building this for you. So total points possible are 22. And if you have questions, email me. Okay, I'm really looking forward to hearing and seeing your presentations. I have highest expectations that you guys are just going to do a good job from what I have heard and seen. I really am looking forward to this. Okay, thanks. Bye.